In medicine, it's real important that we take care of the entire person.
And then take some big breaths.
We would have families that would come in and were food insecure. It became very apparent that we needed to have a resource at the clinic so that we could have patients be able to access the food that they needed.
Our mission at Gleaners is to lead the fight against hunger. We're looking at more than just hunger because we know a lot of times health goes hand in hand with food insecurity. One of the projects we've been working on in the last year is the Food is Medicine project to really focus on partnerships between healthcare providers and food banks and how to provide on-site services that are all located in one central place to make it as easy as possible to get both healthcare and nutritious foods.
So by coming together with Gleaners, Feeding America, we both have the same long-term goal of really improving the health of the people we serve by having access to healthy food for everyone that lives in our communities.
The Feeding America network consists of 200 member food banks, our national organization, and we work in every county in the United States. And being able to provide nutritional food access and other benefits and support through our member food banks and our healthcare partnerships is one of the ways that we are addressing food insecurity.
The Food is Medicine project has allowed the Eskenazi Pekar Clinic to screen their patients for food insecurity. And then if a patient screens positive, they can go right down the hallway to Crooked Creek Food Pantry and receive nutritious foods to take home for their family that very day. And the clinic is also offering nutrition classes for participants to really just learn about health and nutrition and cooking in a really fun and social environment.
Welcome back to the reunion of our Food is Medicine group.
My diet was, fast food, a lot of fast food, and I had high blood pressure. I was pre-diabetic. My doctor initially referred me to the nutritionist, and then the nutritionist said, would you like to take this class?
Setting goals. Does anyone remember setting anything during the class?
I said goals.
You set some goals?
One of them was not drinking sodas and sodium, cutting back on the sodium.
Perfect.
It was so much how you put the meals together, less fat and more fruits and vegetables. Is there any more eggs? From there, I was introduced to the Pantry, and I was like, hey, they have fresh fruit, a lot of fresh fruit, a lot of fresh vegetables, lean meats and stuff like that.
White rice and brown rice.
Food insecurity impacts every county in the United States.
Right.
And at the same time, there is a higher prevalence of food insecurity and poor health for communities of color. So it's really important for Feeding America to drive innovative programs to reduce food insecurity. And being able to do so in conjunction with our partners in healthcare and with our food banks can improve those conditions for folks who are dealing with chronic diet-related diseases.
The fact that we can use access to healthy foods as a treatment that is better than what conventional medication is, and to think that we can actually not only just prevent, but we can actually reverse some of this chronic illnesses in adult patients is really exciting.
Pretty good. I had a checkup, and my blood pressure was getting low, so I'm feeling pretty good, eating pretty good.
One thing I found really unique about our Food is Medicine work is just how powerful collaboration can be. We've really been able to maximize our impact on the community because we've been working in partnership with Eskenazi and Crooked Creek and Feeding America and Anthem Foundation.
Since launching the Food is Medicine project, 14,000 patients have received referrals to nutrition supports and food bank services.
Feeling pretty good.
Yeah, you should. You're doing great.
It's just amazing, and it inspires me to continue doing this work and continue spreading the word in the community. I'm hoping that by the work that Gleaners and the other grantees for the Food is Medicine project have been doing can be a ripple effect for more work to be done throughout the country.